Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. Good afternoon once again. Welcome to our talk here at Akesis Holistic Health. This is Dr. Homer Lim. So for today, we'll be discussing about the most common cancer among men, and that is prostate cancer. Okay, so the leading cause of cancer in men, just like in being breast cancer in women, men have problems with prostate cancer. Okay, so the number one issue with regards to prostate cancer is a lot of men who do develop prostate cancer usually do not complain of pain. Okay, normally there's no pain. Okay. A lot of the issues with regards to having symptoms due to prostate is due to an enlarged prostate. Now, men, as they age, they do have, when men starts to age, as they get older, the prostate also becomes bigger. Okay. Now, why is that a problem? So, the problem, as your prostate becomes bigger, okay, the flow of urine, because the prostate actually is in the middle, and the urinary tract actually flows, okay, or passes through the prostate gland. So as your prostate becomes bigger, then the urinary tract where it's inside the prostate becomes actually smaller and smaller. So as men age also, they will notice that their urine flow, right? When you pee, the urine flow becomes less, not as strong as it was like when they were kids. If you remember, kids, they would play when they're peeing, they try to push their urine as far as, they can. Now, among men who have a bit of enlarged prostate, okay, then the ability of the urine to actually pass becomes smaller. So what happens sometimes, even the amount of urine becomes a trickle. So it becomes trickling. So they really have to really be very, very close to the urinal. Okay. Because most of the time when you have enlarged prostate to the point that, the urine becomes a trickling phenomenon, no? That means that the prostate is really, really enlarged. Okay. So how do they diagnose prostate cancer? So usually, what they recommend would be a digital rectal exam. Okay. Of course, a lot of men are not so keen of having somebody poke a finger in their behind. So one other thing that they would opt would be to do what we call a PSA, or prostate specific antigen test. So with the PSA, when it's elevated, it could be a sign of, a prostate cancer. Okay. But not all people or not all men with an elevated PSA means that it's cancer. It could be due to an infection, or if it's slightly elevated, just above normal, it could be because the prostate is actually enlarged, the size of the prostate. So when men have their ultrasound, usually when they check PSA, it's a bit elevated. Then they get a request for a prostate ultrasound. It's not also very comfortable, but again, because they have to put the probe on the behind, so it's not also comfortable. But anyway, the normal size of a prostate should be around 25 grams. Okay. So as the amount or the volume of your prostate becomes bigger, then you know that the person or the patient is really having a hard time peeing, Now, because we're talking about prostate cancer, usually men, because of its, difficulty in accessing or being able to really check the prostate, especially in the early stages, when it's still microscopic, or it's still, it's still in the capsule, what we call the prostate capsule. Usually, men really don't feel anything. Okay. So by the time men start feeling, severe pain, or, they have pain in their bone, they complain, oh, this old age. But it's actually could be because the prostate has actually invaded the bones, which is because the prostate is also very close to your tailbone. So that could be one of the signs and symptoms of prostate cancer when you keep having pain, especially on your, on your tailbone, right? Or in the middle of your legs, or what we call the perineum. So if they do have pain, then they need to check it, okay? So that's why there is a recommendation now that we have, men should have their digital rectal exam every year. So those who do not want to do that, then they would request for a PSA or an ultrasound to check for, abnormalities or new tumor growth. Okay, so that's what's the difficulty with prostate cancer. A lot of times, it's already diagnosed late. Okay, so what do they do if you're diagnosed late? Then they have to really remove the prostate gland. So when they remove the prostate gland, then could be taking what we call hormone drugs, okay? Drugs that would block your testosterone, okay? So there's a controversy now with regards to prostate cancer and testosterone. So does testosterone or high levels of testosterone cause prostate cancer, okay? Now, recent research shows that prostate cancer and testosterone have really no association, or high levels of testosterone actually have no association with the risk of having prostate cancer. So that's the newer research. So before they were thinking that, because you have prostate cancer, then we have to suppress your testosterone, because that was the way it was taught before. But now we know better. So they found out it's actually men who have high estradiol, okay? So you might be surprised that, men have estradiol. It's true, men do have estradiol. So they found out that men actually who have higher levels of estradiol actually are at higher risk of developing not only prostate cancer, but prostate enlargement, or what we call benign prostatic hypertrophy. So why do men have estradiol, or what we call the female hormones, right? We don't have ovaries, so men don't have ovaries. Actually, there's what we call peripheral conversion of testosterone. So there are also some drugs and some food, okay, that can convert testosterone to estradiol. Two of which is, men's favorite, coffee and alcohol. So coffee and alcohol actually can speed up the conversion of testosterone to estradiol. So it's very important for men, if you are, if you're already having some form of prostate enlargement, do avoid coffee and do avoid alcohol, because these can increase the levels of testosterone in your blood and it can increase the level of your estradiol, okay? So higher levels of serum estradiol or serum estrogen in men are associated with a bigger prostate. So that should be, I think that should be highlighted. It's not testosterone. So now we know better. It's actually estradiol, okay? But in some men who are taking, okay, there have been research now. So in some men who are taking what we call exogenous testosterone. So that means that they're taking testosterone in injection form, or in topical form, or in oral form. So they found out men who are taking exogenous testosterone are at higher risk of more malignant or more severe form of prostate cancer. Okay, so there's still some issues with regards to should men take testosterone if they are already having had their prostate removed. So is it safe to take testosterone? So, the jury is still not yet out on this. So some doctors do prescribe testosterone to prostate cancer patients. So, but we still have to be careful because the data on this is still not so clear. So we have to, err on the safe side. Okay. So, treatments. So usually if you have prostate cancer, the first thing they have to do really is to, remove the prostate. Okay. So, of course, this would be the worst fear of men, right? Having their prostate removed. Why? Because, of course, your sexual function will definitely be affected. Number two, in a period of a few months, your urine flow will not be as good, or you might have a hard time peeing because the urinary tract is still healing. Okay, so that these are things that quite scary for men, no? So aside from removing the prostate, again, as I mentioned earlier, they are prescribed some drugs that actually suppress testosterone production. Okay, however, some of these testosterone blockers do affect men. Then they go into some form of what we call andropause. So we have to understand also, once men go into andropause, it's similar to women having menopause. So they become irritable, undecisive, just like a woman, they become undecisive and they become irritable and cannot seem to make a strong decision. I'm not saying all women are indecisive, okay? Just okay. So aside from that, men also are also if let's say bones are involved, okay, then they have to do what we call radiotherapy. So it's not so nice having prostate cancer if you're diagnosed late. Okay, the good thing, okay, the best thing, I guess, is prostate cancer is actually very easily treated. Okay, it's one of the best type of cancer to have because your survival is definitely very, very good, especially if it's caught early. Okay, so for men out there, if you start having symptoms of having difficulty peeing, or you pee more than twice at night, okay, you notice when you pee, after peeing, you feel like there's still some pee left, but nothing's coming out. So these are the symptoms that you have to be aware of, and time that you need to really go and have your body checked, no, not just your prostate, because there are other issues that can cause that. But it's very important for us to make sure that we to check our prostate. The men, okay, please do check your prostate if you start having those symptoms. Okay, it's better to be diagnosed early than late, because with a later diagnosis, sometimes it's really very hard to treat. Okay, so some tips on how to improve your prostate health. One of the things that is rarely talked about with regards to prostate health is what we call having sex. Okay, so they notice men having sex have less chances of developing what we call BPH, prostatic enlargement, and or prostate cancer. Okay, aside from that, I would suggest saw palmetto. Saw palmetto is a very good herbal remedy to shrink the prostate. Okay, it's not for cancer. Okay, this is to shrink the prostate. Also, squash seeds. Squash seeds are also very good in shrinking. Not only that, it's also very good for men who starts having a receding hairline. So if you do have that, squash seeds are very good. Okay, for prostate cancer, this was done years ago. We're in stage 4. Okay, stage 4 cancers who had already been done different hormonal therapies, surgery, radiotherapy, but did not respond to it. So what they just gave was 5 grams of vitamin C, as well as 500 milligrams of vitamin K, or what we call menadione. Menadione is the synthetic form of vitamin K. So they just gave vitamin K and vitamin D. So what they found out was it actually helped. The PSA levels actually starts dropping. Okay, and more men actually were survived longer than those who were not on this vitamin K and vitamin D supplement. So if you have prostate cancer, whether or not it's severe or mild, very safe is to take vitamin C 5 grams a day, vitamin K, K3, menadione 50 milligrams a day. Very, very shown to be of benefit. Okay. Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.